The studies from Linköping in Sweden, they developed a protocol, or they started before I start. Now we come with the time again. Before I did my polycystic ovary syndrome study, so I looked at their protocol as well when I designed our PCOS study. They selected bladder 15. It's a little bit higher than the innervation of the ovaries and the uterus. Bladder 23, 32. Both were, all were bilateral. And yeah, you recognize all these points. They were stimulated manually or with electrical stimulation, 2 hertz. And it was the bladder 23 and bladder 32 that was connected. These are different studies, but the control situation they had were that they placed the needles superficial. Same number of needles, but superficial placement without any needle sensation. And they also had a group in one of a trial with estrogen. They gave treatment twice a week for 2 weeks, and thereafter once a week, in total 10 weeks of treatment. They found that the number of hot flushes decreased, but they also measured CGRP in urine. So they collected day and night, all day urine, and measured CGRP. There were no difference between, in this first trial, they compared acupuncture with superficial stimulation, and after, directly after the treatment period, there were no difference between acupuncture and the sham acupuncture, so to say. But after 3 months, the acupuncture group, the electroacupuncture group, were significantly better. They also looked at the intensity and number of hot flushes, but also on the Kupperman index, which is one of many health-related quality of life indexes that was improved. But that improved in all groups. Again, meeting a therapist, relaxing, as you do when you go to acupuncture, even though you just put the needle superficial, is a very effective treatment. We should use this in our treatments. Yeah, we should use the interaction much more than we may do, since it's strong. And when they also included, they looked at SCL, it's symptoms of depression, and affective symptoms and anxiety, electroacupuncture did better compared to the no stimulation. In all these measures, except for CGRP in urine, since they didn't do that in the estrogen group, the estrogen group wins the race. It has the absolutely best effect. That's it. Sorry. And here they put together also acupuncture with applied relaxation. So they put together results from different small studies. Both acupuncture and applied relaxation. This may be the most correct thing to say, not mental training. Applied relaxation, estrogen, and also the placebo. And they found that acupuncture and applied relaxation both reduced number of hot flushes and was significantly better than the placebo or this superficial needling when they combined the studies. And they suggest that this is good alternatives for these women. I think here we have absolutely nothing to lose, all to win, to at least try. This is another study performed here in US. I think one thing when you do studies here, it's quite important that you really define how severe patients you should include. Here they defined that they included 29 women with postmenopausal symptoms, at least 7 moderate to severe hot flushes daily. So these women were quite badly affected. And they found that the hot flushes significantly decreased in the active acupuncture group by 28% compared with the placebo group, 6%. So here they actually saw a significant difference. It's one of few studies, I would say, that actually find a difference. The frequency of hot flushes also decreased in the active group. So here they find that stimulation seems to be of importance, and it's better than placebo. So that's nice. But as you can see, it's a very low number. They lie on the side. They lay on the side. Oh, I'm sorry. It was this, yes. How do you do this protocol, since the points both in the back and the front? Here it's no point in the front, but you can. I know that these gave treatments laying on the side. This protocol, they use the same protocol. Yeah. This study, now they increase the number of patients. So this study include 103 patients. And I don't go through the points, since I know that you know this. The CHAM group needling non-acupuncture points, non-meridian areas, 5 centimeters or more away from an actual acupuncture points. And they stimulated with the Qi 1 time, 30 minutes, twice a week during 5 weeks. And I'm not surprised over the results. And you know why? Since I would not say, honestly, is that a spider? I have looked at this. Is it a spider? It's fake. It is fake. Yeah. You should. I've looked at it now a number of times. Okay, concentrate. There were. You can see there is absolutely no difference. They stimulate the same, and with in my view, since I'm not saying that the acupuncture points are unspecific, but I think when you place a needle just 5 centimeters from a true acupuncture point, you're still in the same innervation area. You're still doing exactly the same thing. You get the afferent input, and I'm not surprised. But you can see this is published in a journal in Menopause. This is a major journal for people working in this area. And the conclusion is detrimental for the use of acupuncture in this area. This is saying medical acupuncture was not any more effective than reducing hot flushes than sham. And if you're not an acupuncturist and don't know what this is, they say you should not use it. So I think this is very much, they should have a non-acupuncture group. So what they actually do, they compare two different sets of acupuncture points that seems to be equally effective, in my mind at least. I don't know what you think. So at least at the follow-up, it seems that the acupuncture group, or what they call the acupuncture group, do a little bit better, but no significant differences. And then we come to the big study performed in Norway. And in Norway, it's our neighbor country, and in Norway, I think there are very few working with Western medical acupuncture. They work with traditional Chinese medicine, and in Sweden, it's completely opposite. I don't know why. They gave acupuncture, and it was traditional Chinese medicine trained doctors. And the acupuncture is free to diagnose and select points and individualized treatment for each participant. And they should evoke needle sensation at least once. They gave 10 acupuncture sessions over 12 weeks. And immediately after these 12 weeks, hot flash frequency and intensity was significantly lower in the acupuncture group, and the acupuncture group experienced improvement in vasomotor, sleep, somatic symptoms in Women's Health Questionnaire directly after. I would say that it was a randomized controlled trial. The control group, they could get whatever they want, except acupuncture. So they could go on herbs, they could go on diet, they could even go on estrogen. So the control group could get any treatment. So this is more what we mean a pragmatic trial, what you do in daily life. And a little bit strange in my mind, they published the follow-up in a separate paper. They did a long-term follow-up, both 6 months and 12 months after the treatment, which is very good since it's few studies that actually perform long-term follow-up. That is really what's missing in the field. So the treatment is exactly the same, the two groups. After 12 weeks, the reduction in hot flushes did not last for 6 months or 12 months after treatment. So the control group came along, but what's not given here is that the control group, after these first 12 weeks, they were allowed to take acupuncture if they wanted to. But they don't really have any record what they did. This is in one sense, the beauty of a pragmatic trial, but it's also the limitation of it. So they didn't see any long-term effects. But I would say, if you look at the data, they see a long-term effect. But the control group catching up and getting better. Are you with me, what I mean? I think that, yeah. Who is the, yeah, who had they published it? Yeah, yeah, but who is the author? Mm. I'm coming to the tamoxifen treated patients soon. Yeah. What the interesting thing here, that I didn't put up here is that the doctors were free to select points according to traditional Chinese medicine, and there were a huge number of acupuncture points used, and they also did the diagnostic pattern, and they didn't find any difference between the different diagnostic patterns. They improved as much or as less. It was the same. But the beauty of it, I think, at least, is there were a core of 8 or 10 points in all patterns. It was the same points in all patterns. And it was spleen 6, it was spleen 9, it was liver 3, it was CV 3, 4, 6, and they came back, and there was some more. So they came back. So they used like fixed protocol, but they varied the other needles a little bit more. And this, it seems that one picture is missing. I'm sorry for that. This is just another study, a multi-center randomized trial, where they gave acupuncture, and the control group was just a control group, giving no acupuncture, no sham, nothing. And you can see that they improved a lot in their hot flushes score over 24 hours. And also the menopause rating scale score improved a lot, which is the health-related quality of life. So acupuncture, in addition to usual care, is associated with marked clinical improvement in hot flushes and menopause-related symptoms. So just adding it to usual care, I think, is what we should do. And if we can keep down the use of estrogen, I don't know if it's very common to use what are you using here? Yeah, you use but not if not estrogen, you use herbs that have an estrogenic effect. Phyto. Yeah. Yeah, but does they have an estrogenic effect? Yeah. 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 Mm. No. No, you can. Okay. What? Wild jam? I don't know what that is. It's potato. Okay. Okay. Yeah, that's out of my area. So when all these articles, not the article that you mentioned now, was reviewed not many years ago, you know that we should work on the highest evidence, and that is our systematic reviews. And their conclusion is that there is no evidence from randomized control trials that acupuncture is an effective treatment in comparison to sham for reducing menopausal hot flushes. And that is when you combine these all the sham acupuncture trials. And of course, one of the trials, they compare two different sets of points. But I think this is the thing that we need to come away from in acupuncture research. But we still, it seems that we are very much stuck, that we need to have some kind of sham to get the articles published in better journals. So it's really difficult to say how to come away from this. I think it's a big problem. They also conclude that some studies have shown that acupuncture therapies are better than hormone therapy for reducing vasomotor symptoms. I say that I'm surprised over that conclusion since I haven't read that. And the number of RCT compared with non-penetrating placebo-controlled needle or hormone therapy was too small, and the methodological quality of some of them were poor. And they also suggest that evaluation of acupuncture on hot flushes should be in well-controlled placebo trial is therefore warranted. And if it's not very specific for menopausal symptoms. If you go into any area, you can read this conclusion. And that's, again, what we have to come from. We leave, since we need to make design of our studies in a little bit different way. But it's difficult. It's truly difficult. I have no solution.